Lehigh Valley Chapter. Listen, thank you for inviting me. I love this kind of stuff, and I can't wait for all this to be in person again. But this is an amazing topic, mental health and wellness. I mean, look at the last 2.5, 3 years. And now we get to enter war and climate change and what a total disaster we have going on. So this couldn't have come at a better time. We have some phenomenal groups on here who already introduced themselves. We have United Health Group, CHOW, Unity Recovery, and Wellness Coaches USA. So we have 4 groups. I got about 30 minutes. So my goal is to cram as much awesome information as humanly possible from this group. So we're going to just dive right in. So United Health Group, Kimberlee, can you provide any insights into the state of mental health in the hospitality industry?
Yes, Brian, I can. So I think we need to start with the general population health stats. And we know that before the pandemic, there was a mounting mental health crisis, substance use, suicide in the hospitality industry, which, as we know, was significantly exacerbated by the pandemic. So the stats are, the data's coming in since March of 2020. There is a 30% increase in mental health issues, in depression, 30% increase in people who are reporting depression. There has been a 30% increase in drug overdoses. For the first time in our history, we exceeded 100,000 drug overdoses in a 12-month period of time. The American Academy of Pediatrics last year declared a national state of emergency in child and adolescent mental health. 65% of all counties in our country do not have a single psychiatrist. Think about that. 65% of our counties in our country don't have a licensed psychiatrist. So these, you look at hospitality, excuse me, you look at the general population, we are all burnt out. As Brian just mentioned, we had the pandemic, we had January 6th, we have the war, we have the race issues, we've got injustice, we've got so much going on, we're all burnt out. And if you look at hospitality, it's exacerbated even more, because look at what hospitality workers experience. They are overworked because there isn't enough staff. There are obnoxious customers coming in every day being rude and disrespectful and over demanding. You'd think that the pandemic would have made us kinder and gentler, but the things that hospitality workers are facing every day, rude customers, frustrated, the kitchens being behind, customers not being happy, customers being upset that half the dining room is closed because there aren't enough people there. Restaurant workers and hotel workers need to be COVID police in some markets, turning people away, et cetera. They constantly need to serve other people in hospitality. And so the mental health crisis in hospitality is real. And we need to start helping people now. We're losing people. And that's why we're all here today.
Kimberlee, that is well said, and my stress level went up already.
Well, and on top of that, if I could just mention one thing, is the paucity of people in hospitality who have access to health benefits. So you've got an industry full of part-timers and people cobbling together multiple jobs. They don't have access to employer-sponsored health benefits. So we all need to come together and help people, help the part-timers, the seasonal, everybody get access to quality mental health care.
Well said. Thank you for that, Kimberlee. I appreciate your answer to that question. And we all know that's a reality. I agree. Melinda, CHOW. First of all, before we jump into your question, can you remind me what CHOW stands for again, please?
Yes, CHOW stands for Culinary, Hospitality, Outreach, and Wellness.
Just wanted to make sure everyone got that before we jumped on. Appreciate that. So tell me a little bit about yourself and your journey and how it led to you to CHOW.
So 30 years in the restaurant industry. In 2015, I was hitting my bottom, working at a James Beard award-winning restaurant in Madison, Wisconsin. working, as we all do, 100-hour weeks, drinking to cope with side effects, completely abandoning myself to medication as my solution, taking copious amounts of antidepressants, taking copious amounts of anti-anxiety pills, not recognizing that the amount of alcohol, which is a depressant, and stimulants that I was taking in might be shooting those medications in the foot. But nobody was talking about it. Nobody asked me those questions. I went to my employer at the time and I said, Beth, I don't know if I can do this anymore. And his solution, and he did his best. He did what he could with the tools he had at his disposal. He suggested I take some time off, but I don't know if anybody else can resonate with this. If you're suggested to take some time off, it's basically like being exiled, right? It's being outcast from your community. That was not the support that I needed. What I needed was for him to have the language, Mel, I care, and I'm not qualified. Let's take a look at that resource binder in the office. Let's get you connected to some community-based resources. The solution is, I feel, let's get people in the workplace talking about this and let's see what's working for them, right? So that you're not feeling like some sort of broken toy in the workplace, right? And so fast forward, I have found recovery. I've got 6 years in recovery, 4 years of abstinence from mind and mood altering substances. And what CHOW has been trying to do is to create a network, to create the resource, to create the support networks that we needed and didn't have for the past 30 years. We are open to servers, chefs, managers, owners, farmers, agricultural workers, food truck drivers, you name it, right? Because there's no place in hospitality where food service and human service don't intersect. By definition, hospitality is the intersection of food service and human services. And so we know that there are people in our industry who are capable of offering support. We're talking shoulder to shoulder, dance go to dance go, knife roll to knife roll, right? Who have the tools, who have the ability to support one another so that we do not rentify our owners and managers. Right? We do not want to make our owners and managers our therapists, our counselors, our coaches, our clergy, right? The last thing that the restaurant industry needs right now is more pressure on it. So when I hear somebody say, oh, and my anxiety is already up, what offering recovery to our workforce is going to do is take the pressure off the restaurant managers, take the pressure off the restaurant owners to have this assumption that they have all the answers. So I'm about to dump a ton of resources in the chat and they're gonna all mash together there because that's how Zoom does it. But the top document that I just sent in was a recovery-friendly workplace toolkit. This toolkit has some links in it for your ADA, which is your American Disability Act, and FMLA resources to let you know as an employer what your responsibilities are and are not, so that again, we could take some of that pressure off of folks. There's also right there in Pennsylvania, I'm so glad to see so many peer supporters on the call today. PRLA has a list of recovery community organizations in your communities in Pennsylvania so that you can access. For me, my story includes being a woman who was dying of thirst right next to a lake because nobody talked about it in the workplace. I had no idea what resources were available to me in the community. It would have been as easy as maintaining a resource binder, but that's not what happened. The next that's in that chat box is an article from the end of April. President Biden, this isn't a maybe we can do this. This is a we have to do this. President Biden has put into his initiative recovery ready workplaces as part of his rollout campaign here, right? So it's not whether or not your restaurant can be recovery friendly, it's going to be recovery friendly in the near future. So you who are on the call right now are going to be the new guard. Might be the old guard in some respects in the restaurant industry, but you're going to be the new guard because you're ahead of the curve already just by being present here today. So I cannot thank you enough for being here. And then finally, the last thing that you're going to see down there is the Mind the Workplace survey, which Mental Health America, which partners with CHOW, it's their compilation of data from this past year, basically letting you know how much not just absenteeism costs you as a result of mental health and substance disorders, but also how much presenteeism costs cost you. And if you haven't heard that word, it's basically when you're paying $15 an hour for somebody to show up and they're only giving you $12 an hour of their actual whole presence, how much your business is losing as a cost of people showing up in states that are less than desirable. So I'm going to be quiet now because I know Brian's going to have some other questions for me later, and y'all can explore those resources on your own.
Awesome.
Thanks.
Melinda, thank you so much. Thank you so much. I appreciate that. And again, I don't think anyone on this, what do you call it, a call, a Zoom, a video, has heard anything new. What I do think, though, is it makes it reality, makes it realistic. And you're absolutely, both of you are absolutely right. Next up, we have Unity Recovery, Robert and Brian. The question I have for you is, what do you think or feel is keeping folks in the restaurant or hospitality industry from reaching out and seeking help?
Yeah, I'll take it first, and Ryan can certainly add to it. So I think a lot of the reason, especially from the first answer, talk around it, but I think the assumption is, in first part that's non-culture related, is that if people reach out for help, that it's their livelihood. What do they do in the alternative? Whether it's from a lack of insurance, a lack of paid leave, a lack of benefits that would do short-term disability. I mean, any number of reasons that, seeking help in large portion, when you weigh the risks or pros and cons, results in a lack of income and taking care of all their different responsibilities. But I think more so, and I say this both in my role, but also somebody that was in the restaurant industry and then has gotten to recovery and now runs recovery-friendly restaurants. It's culture. The work hard, play hard culture of kitchens, or front of house, back of house, the entire service staff. Something you just don't talk about. It's in large part, it's encouraged, whether it's war stories or battle stories of drinking and using drugs together. The prevalence rate among restaurant and hospitality workers is just sky high. And that's having open and honest conversations that require a level of vulnerability is not something I would say that the restaurant and hospitality industry can hallmark itself on. These conversations they're happening more than they ever had, but these still aren't conversations that often occur. And if they do, most restaurateurs, managers, et cetera, are not equipped to have them yet. They may be dealing with the same issues themselves. And that's a perfect storm of creating an environment where it's, let's just not talk about it and continue to the next service. And that's not a breeding ground for asking for help, whether it's appearing weak, being afraid of losing money, or just not thinking that you can get any information.
Robert, you bring something up that's pretty important. You see the stigmatism of asking for help. And, one of my colleagues a while ago said, it's like toxic people helping toxic people. When you're not equipped or you're not trained to do that, you can actually make things a lot worse. So what do we do as humans? We hide from it, ignore it, and pawn them off onto someone else who's also not qualified. So I think what you said is spot on, but just like the gambling, what's the gambling phone number at the end of all the gambling commercials? 1-800-GAMBLER. It's like, that alone is horrible. So you're right. It does create an environment where people are afraid to ask for help. So thank you for that. I appreciate that. Meg, Wellness Coaches USA. How has the pandemic impacted workers' overall mental health?
Gotcha. Well, again, thanks for having me here. I just actually 2 days ago did a mental health first aid training session. They're all day training sessions for the public. I did this one for a large pharmaceutical company, and they discuss even in that industry, but particularly I think in your industry, it's a disruption. It's just a massive disruption. And I think uncertainty is the word, right? It caused a great deal of uncertainty, and, not just with our work, but our family life, right? The isolation that people experienced, their comfort levels of just, so they're living day to day in a space and time that is just totally unfamiliar. And that is chronic stress. And I think it's interesting, the American Psychological Association reported that 54% of workers admitted to relying on unhealthy habits to get through the pandemic. I think that speaks to something about what we heard about the 30% increase in mental health challenges, 30% increase in substance use. 75% of workers said they did not have the emotional support that they need. Interestingly, we deal a lot with health risks, right? The way health risks in our country increase. 50% of workers claim that their weight, they had unwanted changes in their weight. And of course, for most people, that means weight is going up, which means increased diabetes, increased cardiovascular events. And then we knew too with the pandemic that those people weren't getting treated either. So now I think we're going to start seeing a greater percentage of, backlog of people receiving the care that they need for chronic health conditions as well. Sleep is disrupted, so nutrition, right? So the foundation of what keeps us healthy and what guards us against mental health challenges was eroded, completely eroded.
Meg, can I ask you a second question? Can you explain what a mental health first aid is?
Yeah, I got to admit, I am super passionate about mental health first aid. It speaks to what the gentleman just said about stigma, right? American Psychiatric Association, their studies have shown that while concern is high, we're all expressing concern. Willingness in general to talk about it is very low. So mental health first aid, the reason I'm so passionate about it is it's a public education program. And it isn't just targeting people who need help, right? It's targeting all of us. Much in the same way that you can receive a CPR certification to assist someone in a cardiovascular event. With mental health first aid, it's everyone raising their literacy around mental health. Everyone, and here's the key, everyone learning the skills to listen and to talk about it, right? And that's important. And then it is learning to speak about resources in a way that gives reassurance, that addresses fear. So a lot of what we said about what keeps us from getting help, some of that is fear. Some of that is fear of losing autonomy, right? Oh, what are they going to make me do? I'm not going to be able to get back to work. But it really helps all of us learn how to talk about resources in a way that make people more likely to pursue the care that they need. And it also really reinforces something I just talked about, which is all those foundational behaviors, self-care, whether that's sleep, nutrition, whether that's physical activity, whether that's some of the great apps that are out there. So I think it's really addressing this from all the right angles and helping to make it okay to talk about it and make it okay to not be okay.
Very wise. It's before I go to the next question, you talked about people coping through the pandemic. I run every morning, 6 days a week, 4 miles a day at 7 a.m. And during the entire pandemic, I would literally run, and I never saw it before. Everyone's recycling bins were piled high of beer bottles, wine bottles being hidden by pizza boxes.
Wow.
And I'm running going, huh.
There you go.
It's an observation. You look at that and you're going, yeah, you're absolutely right. So, all right. Well, I don't want to thank you, Meg. I appreciate that. And I also appreciate you explaining the mental health first aid. I'm going to assume that there's first aid kits available for people to use in their shops. So that leads to my next question to Kimberlee. How are people in hospitality accessing mental health care? How are they finding it? If I know I can't go to my boss, who's a spastic, crazy person, not for real if he's on this call, but where do I go?
Well, that's just it. They're not accessing mental health care because they don't have insurance. They don't. And here's the reality of the accessibility of healthcare. If people are in a crisis or they are realizing they're depressed, they're anxious, they could use some help. Since the pandemic, it takes anywhere from 4 to 6 months for anyone to get an appointment with a psychiatrist, if you can even find one. So once that 4 to 6 months is over, the crisis is gone. There's no accessible, immediate care for people, but there is, actually, there is. And that's what's joyful and happy that all these folks are on this call, because the issue is real, the crisis is real. People in hospitality, because there are so many barriers, time, money, shift work, transportation, all that stuff. They're not aware of the resources, but the resources are there. And I know folks on the panel have resources. I've got incredible resources, and I'm hoping we have time to talk about them. Surveys show over and over again that workers in hospitality look to their employers to offer resources. So, you know, as the other panelists have said, we need to empower employers to be able to talk about it without being frightened, without being afraid, without worried about liability, without being worried about liability, because anyone who's a manager of people is very careful. You have to be very careful. You don't want to say anything. You want to back up. You don't want anything to do with it. We've got all sorts of resources to help with that. So tons of barriers. People in hospitality are not getting the mental health care they need, but we've got solutions. So I don't know if you want to come back to me for those solutions or hit them now.
Why don't you spend a couple seconds just blasting them out? It'd be great.
All right. I'll be as fast as possible. So, so it is, the stats are bad, the data is bad, but the wonderful thing is there is something we can all do. There are things we can do to help turn this around. So I'm going to run through these. So Melinda was mentioning, I think it was Melinda, mentioning a toolkit. So we underwrote a research and development initiative with Active Minds, a national nonprofit, entirely focused on hospitality. So we did surveys and focus groups and interviews of all levels of front of the house, back of the house, hotels, management, owners, operators, everyone, to identify the drivers of the mental health issues in hospitality. And we have a guidebook that's free for everybody, that's entirely focused on hospitality, what every manager, owner, and operator should and can be doing today to help their teams. Free, easy things, easy suggestions, peer-to-peer, manager to employee, et cetera. So absolutely free. I'll put in the chat room how you can get this. The other thing that is amazing is we have a partnership with Teladoc, the global leader in virtual care. This is the number one thing that every hospitality employee should have access to. This is the single best tool to break down all the barriers that the hospitality industry has to getting gold standard mental health care. And I'm going to run through it really fast. It's $9 a month for an employee. Includes that employee's entire household. So it's employee plus household, $9 a month. And this gives people unlimited physical health care, unlimited dermatology, unlimited physical therapy. We need to get people off opioids. We need to provide physical therapy, unlimited nutritional guidance. I think Meg was talking about the weight gain and such. But the most impressive part of this Teladoc offering is the mental health care. It's unlimited. It's $9 a month for a person in that person's household. Unlimited mental health care from US-based licensed psychiatrists, psychologists, therapists. You can go to this, go on Teladoc's Healthiest You, pick out your psychiatrist, pick out your psychologist, whoever you want, establish a relationship with this person, meet with this person 5 times a week, 5 times a month, 5 times a year. It's still $9 a month. I use this myself. Sounds way too good to be true. All my kids have it. My friends have it. My mother has it. I've bought it for everyone. It's amazing. No co-payments, no charges, no nothing. It's incredible. It's how I fell apart mid-pandemic. I needed a psychiatrist. I had one in 7 days through Teladoc. I've seen that person every single week for the whole year. $9 a month.
Can you put all that into the, what do you call that thing? Chat box, so everyone can have all the links and kind of get all the information that you do have? Because it doesn't do it justice, Speed doing it now, but can you give all those resources to everybody?
Absolutely. And we can do, I can have a demo done for you. please consider giving your teams the gift of this, because it is amazing. One more thing is, in partnership with the National Restaurant Association Educational Foundation and CHOW, we are underwriting the first of its kind. Someone was talking about a mental health certification. This is going to be a mental health certification program just for hospitality, to help owners, operators, managers know what to say, how to say it, and what to do, and create that kind of safe place. So we've got tons of great resources. I'll put them in the chat room. Feel free to contact me. There's help out there.
Awesome. Thank you. And thank you for the passion on that too, but please get those in that chat box. I would love to share that with my team as well. Thank you for that. Robert, what sort of workplace culture changes are required to alleviate stress and promote a healthier alcohol or drug alternative ways to maintain mental health?
Yeah, so I think there's a variety, and for the sake of time, I'll try to hit some pertinent ones that can happen at all levels. So I think at the top, and I say this both somebody that worked in it and current owner operator, is we have to do better as owners and operators. We need to offer benefits, including flexible part-time benefits. We need to pay living wages in addition to tips. Paying under minimum wage is no longer acceptable. We need to offer flexible benefits like short-term disability and long-term disability. We have to treat our staff, especially after the last 2.5 years, like real people and not servants, just like sometimes our disgruntled customers might. We have to do better, because the change really starts there from my perspective. And I think looking at recovery-friendly workplace policies allows for that. That may sound confusing or difficult because anxiety and stress and things we have to do already, but there's support out there. A lot of resources that have already been mentioned, but it's got to start with the top, treating our staff better. I think secondarily is in SOPs, steps of service, wherever you want to put in your handbooks, we've got to start talking about the work hard, play hard culture. Coming into the kitchen, back of house or front of house, existing in the back of the house, literally, and talking about going out earlier, later, sharing drugs, like all of that has got to be addressed in a more active approach, taking to create, whether it's recovery supportive environments or not, that's not the status quo of what engagement amongst staff looks like, because it's the norm. But that's, again, got to start with buy-in from your staff, having open and honest conversations around what you want the workplace to look like. And again, it's not telling people not to drink or even use recreational drugs if they want. But until we start having those conversations as a team and all our team members, no culture is ever going to change. And I think the latter part of it is also just looking at the work environment itself, right? When we expect people to pull doubles 6 days a week, even if we're short staffed, and I think it was mentioned at the start of this call, we start to self-medicate, whether it's from emotional turmoil, from physical turmoil. We've got to do better somehow in creating work-life balance, because work-life balance breeds wellness. And right now, and for probably forever, work-life balance is not something that exists in hospitality. And those are all different elements of the culture we've got to change. And it's no small task, but it starts with having conversations, which again are beginning to happen with webinars and events and internal conversations just like this one.
Robert, you mentioned some great things there. I mean, 2019 and past, we've had a lot of uphill battles and challenges. And now you look at 2020 moving forward, workforce shortages, supply chain issues, negative guest concerns, environmental issues, all go against work-life balance. It's pretty tough. You see restaurants closing at 8, closing 2 days a week. There are a lot of positive things going out there, but man, it is a negativity barrage out there as well, hitting our industry and all industries. But it is culture. I mean, obviously culture eats strategy for breakfast, as you all know. So if you have a greatest strategy in the world, but you continue scheduling people 7 days a week because you have to, we got to do things different. So thank you for that one.
And I would add, I just want to add, because I think it's a good point, if I may, if there was ever a time that we could reimagine what this industry looked like, it's right now for all of those reasons. So there's never going to be a better time than literally right now to do this work.
Yep, agreed. Well, thank you for that. Melinda, so we did touch on CHOW a little bit. Do you want to go in some more detail and really just explain CHOW, explain your role in Colorado, and explain, is it bigger than Colorado? Can we get access to that one? Is it open to all hospitality?
Yes, it is, because most of our offerings are virtual. Anybody with access to Zoom on their phone or on their computer can join us. We host 6 meetings a week, Monday, Tuesday, Wednesday, because we know Thursday, Friday, Saturday, Sunday, most of the time people are too busy to join us. But we have a group that is led in native Spanish, because we know that not only is the hospitality industry in general underserved and underinsured, but our Latino component is particularly so, because there's not parity in a lot of the services available in the community in general. And then we also host a meeting that is specifically all women or women identifying on Tuesday mornings virtually again. So we have people calling in from Vancouver. We have people calling in from Australia, from Spain, you name it. Anybody can join our groups. Anybody can take our mental health training. It's 4 90-minute sessions. I put the description in the chat there of what that looks like. And then basically what we are trying to do is create a community, as Robert mentioned. I'd like to applaud everything that Robert said, but a community where the substance use is talked about, where mental health is talked about, where new ideas are talked about, those sorts of conversations where people can be safe and be vulnerable. We know that the restaurant industry has a very enmeshed, very toxic culture that expects us to get all of our needs met within the 4 walls of our restaurant, our financial needs, our social needs, unfortunately, sometimes sexual needs, our spiritual needs. Sometimes, if you've ever heard of the restaurant referred to as my temple, right? What we want to do is break down that enmeshment, start to untangle and start to identify. And the millennials are leading us this way anyway. If you're watching the trends, we don't want to make friends at work. We need to stop calling each other family, because what family alludes to is these toxic bonds where people are forgiven. Boys will be boys, or oh, that's just Mary. She has a temper, that sort of thing. We need to break down those toxic bonds that we've been relying on to get people to overwork. And our millennials are coming in. Our new guard is coming in saying, "Yeah, I'm not doing it. I'm not doing it. I'm not gonna go on retreats with my coworkers. Work is work, and my life outside of work is my life outside of work." Also, we're trying to break down that teeter-totter work-life balance. Work is part of life. There's 6 other areas in our lives that we can focus on. Why do we focus on just work and just life, right? Work is part of life. So how can we get somebody to be fully integrated in their communities, in their families, right? With people whom they have shared lived experiences. So that's what CHOW is based upon, is the shared lived experience of having worked in the restaurant industry and the side effects thereof. We're talking relationship issues, mental health issues, substance use issues, and things like that. And sometimes the people in our families, just like the people in our workplaces, are too close to the problem, right? We can't be open and honest because there are strings attached. You'll get fired if, you'll get kicked out of the house if, right? I used to live in Minnesota, and so I'll quote Bob Dylan here. When you've got nothing to lose. So people's investment in CHOW is completely voluntary. And there's no, I'm going to tell your parole officer. There's no, I'm going to get you kicked out of the recovery residence. There's no, I'm going to get you fired, right? Like, we can be honest. It's a confidential environment, and people have found it really helpful at reducing their stress to have people who they can talk to who get it, who aren't saying, you got to quit that job. We get it.
Well, thank you. All right, I'm getting the hook here. So what I want to do is give each person 30 seconds to just give fair parting words for the group. So Kimberlee, you're up. 30 seconds. What do you got for words of wisdom?
Oh my gosh, I'm sorry. Teledoc, teledoc, teledoc. Please call me. Please get a demo. Please look at this thing. It can help save so many lives. Those are my words of wisdom.
Love it. Thank you. Melinda, 30 seconds. Words of wisdom.
That's what Kimberlee says. It costs $10 a week to give your staff shifties.
A month.
It costs, give shift drinks. It costs $10 a week to give shift drinks, right? It costs $10 a month to connect them to the services that they really need.
Yes.
So my 30 seconds would be listen to your staff. Do not design from the whiteboard, as they call it. Make these decisions in the office with your managers. Have talking sessions, have town halls with your employees. Find out what they want. Don't give them something they don't want, because they won't use it, and then you'll resent them for not using it.
Thank you. Robert, 30 seconds. What do you got?
Yeah, since everybody's in PA, I think all the resources have been given are great. If that is even too much and you need something free, so Unity Recovery, we've got over 40 peer staff. We're heavily funded by the state, including on the recovery-friendly workplace and employment support. So Ryan, I'll ask or Gio to put in the chat our website. If you need any of your employees to access telerecovery or direct recovery support services, one of our certified peers, it's completely free and easy to do and cost you nothing. So don't let any number, even if it's $10 a month, be a barrier to you, because there's also free support right here in the state.
Awesome. Thank you. Meg, 30 seconds. What do you got?
Oh, boy. Well, consider a global initiative as mental health first aid. It's incredibly inexpensive because it really is about meeting people where they are and trying to assist everybody in raising mental health literacy. And also consider putting a wellness coach on site for your staff. We have wellness coaches that we deploy right in the workplace, and they touch very brief but frequent touch points to help people learn how to prevent burnout, to help people learn how they can put themselves first on the self-care list. So I think that addresses a lot of what we said about the foundation of health and mental health. So consider that. Be happy to chat more about that.
All right. And everyone, make sure you drop as much as you can in the chat box, please. So before I send this over to Jenny or Heidi or anyone, I like to kind of repeat a couple buzzwords that I heard today. So let's go with the negatives: burnout, volatile, hostile, drinking, coping, no help, stigma, no insurance. I'm ignored. My cry for help is unheard. No resources, toxic people. The list goes on. Flip the coin. Listen, talk, learn, find those resources. Know the warning signs. Be there for your team. And by the way, which creates retention and a healthy environment. Address concerns head on. Remove the stigmatisms and find those resources. Be flexible, pay well, offer benefits. Do you know the negatives, but don't swim in it. All right. Find those positives to help drain that damn cesspool and help those people who need our help. Guys, it was an honor to meet every one of you. You guys are amazing. But remember, you know, whether you think you can or you think you can't, you're right. All right. So make sure you know that. Think you can. So I will turn this over to either Jenny, Heidi, whoever's taking this on. Thank you for letting me do this. Have a good day.
Ryan, can I just add, I don't think I used my full 30 seconds. So can I have 5 more seconds?
You got 5 seconds.
5 seconds. Okay. For our mental health ally certification program, we need volunteers to be interviewed by Psych Hub for lived experiences. Anyone with experience that has hospitality, is hospitality related, and has substance use issues, suicide, mental health, anything. We desperately need people to be willing to help with this. Please let me know. My email is in the chat. Thank you.
Thank you, everyone.
Thank you, everyone, for all the great information. I think that all of us are going to walk away with definitely some tools in our back pocket that we have been lacking and needing. So thank you again very much.